I want to cover problem list management. We've kind of covered this already, but I want to just show you whenever you click on the problem from the reference panel, you get the problem overlay. And we can add a problem here. So let's say we wanted to add asthma for this patient. Again, if we have the free text option here, or if we wait for the list to come up, we'll get the asthma with the code attached. We can change the category, we can adjust the status, so we could say it was chronic. This option here will add it to your patient's family social history, and you can add it for this current visit so that it'll be part of your assessment and plan. And then again, you have the add to my that will add it to your list of problems to manage if you were going to manage it that way. You can add a comment here, and that comment will show up also in your problem list. So we could add, maybe just a note, exercise, and then hit save. Now we do right now have an asthma protocol active, so it's asking us, do we want to add the asthma protocol? We have listed here this generic doctor here as the one who is managing that protocol. We hit save, and we've added that problem and the protocol to this patient. As we mentioned before, our workload screen works much like your task list does today. So you have a list of tasks and or results that flow in here, maybe communication from peers or others that you need to review and respond to. In this case, we have here in our inbox, it's still letting us know we have 11 messages that we have not reviewed. We have the ability to search our inbox, so if we were looking for a record on a certain patient, we can input that patient's name. Let's try this test Meg here. So test Meg, we see that we have one message in our box for that patient. So if you were looking for a particular patient, you could search for them that way. We do have coverage on, so we're covering for someone else's box. And remember, if you want to see who you're covering for, you click on the coverage person and you see edit coverage. So you see we're covering for Dr. Bojrab, so that means we'll see both all of our messages and Dr. Bojrab's messages within our workload box. We can sort by priority. Every message is associated with a priority, so high, medium, low. We click once, we get the high at the top. We click again, we have the low at the top. We can also click by time, so we default to the most recent, so we see the most recent task on this list is this inpatient test result for test Hemocult 2 days ago. So we can click here on the patient's the message, and it'll open up the workload task here. We see this patient had a blood type and screen. So if we wanted to, maybe got a call from the patient wanted to know what this result was, or we wanted to call and let the patient know what the result was, you could just type a quick message here to your clinical support person, please inform patient of results. And then you would forward that. So you could forward that to whoever. So you would pick the name here. And again, you should be able, if you send it to a work list, you should be able to send it to a specific work list within your office. So let me say I want to send this to all of the clinical support people at Hancock Family Practice. I would click this group here, and then I could hit the send, and it would send that message to all of them. Again, if you're working with a specific person, you would just search their name and click send and get it to them. Now, some other functions down here, move to old. This would move it. It's kind of an archiving system within the program. So if you click down on the down arrow in your inbox, you have this old bucket here. If you click move to old, it would just put that in there so it wouldn't be taking up space in your inbox because you've maybe already addressed it. Delete deletes it altogether, and much like the current system, if you delete or complete a task, it takes it off the list for everybody. So you want to make sure if you're not done with it, you don't do that. We already kind of covered forward. If you wanted to keep it and mark it unread so you see it again when you go, you can just click there and it'll move it back into blue and update your number up here to 12. If you wanted to take yourself off the list, you maybe got this result and you don't really need to look at it anymore, but other people might need to. You could just click Remove Me, and it takes it off of you, and you don't see it. You won't see it anymore. And that's a quick overview of the workload task list. I wanted to go over a few of the functions of the More button up here. So you remember we talked about before, we would discuss some more of the functions here. One of them I want to focus on primarily is the ambulatory preferences component. And you'll see if you click on ambulatory preferences, it has the components of the chart broken down into different sections. So you have your general information for the chart. You have that chart summary document, which we've already covered a little bit. Document, orders, clinical home schedule, etc. So one of the things I want to make sure and point out is you should be defaulting to English and Fahrenheit here. That should stay that way. The CDC websites, that is not Centers for Disease Control. That is clinical decision content websites. It's another way. We showed the quick links earlier, and I'll show you how to update a quick link. But also, you can add a clinical decision content website, which you can access from the More button, and I'll show you that in a minute too. But this is where you would add the address and put the name, and that would show up under that CDC, that clinical decision content website. And you can add multiple, again, as many as you need. Here under chart, again, we've covered this already, where you can update the order of your widgets. You have the way that you can adjust your document view. Again, I don't really see a lot of different options that you would necessarily want, but you can change the size of those default text boxes to larger size. General consensus is they're big enough already. Orders, too, you can change some information on your order screen, change some of the defaults here. One of the most important ones I want to show is here on the clinical home /schedule, and you may or may not have any of these yes/no questions answered here. But one of the most important ones I want to make sure that all of you have included here is to include the orders indicator on the clinical schedule. Need to make sure that that says yes. That is the indicator that gives you that blue box on the clinical home screen with the O or the L for those office procedures that you need to go back and complete. So that's that indicator. And remember, you're not going to get a task generated on the task list anymore. That will be your only indicator that you have something to go back to do other than someone telling you that. So I wanted to point that out. The other thing is up here on quick links, this is where you would add add websites that show up on the home screen in that bottom right hand corner. Under quick links, you would add the address here, the website address here, and then give it a name. That's kind of all I wanted to really show on the More screen, but I just want you to just take some time to go through there and see if you can maybe adjust the way some of the things look to help serve you better.